My name is Evelyn Prech. I'm a founder, executive director of Center for Indigenous Child Rights, a community based in West Pokot. I'm also a grantee for NAAPU Fund, and I'm a human rights defender. So on the status of gender-based violence, I actually work on the rights on areas gender-based violence. So what I can say from West Pokot, from when we did the baseline survey, it showed clearly that there has been an increase, especially during time of COVID, on the issues of gender-based violence. And so there were like issues of forced marriages, issues of for domestic beatings, a lot of conflict, domestic fights because of issues of COVID that time. So but now again, it went down a bit after COVID. Now during this time of drought, the community has gone down because there's no food, people lack food. So there has been a lot of fights. Also, there have been issues of insecurity with our boundary counties like Turkana County, and also neighboring communities like Marakwet and those in Baringo County. So we found out that now issues of gender-based violence are coming up again, though the reporting has been a problem. So from my learnings today in these meetings, that the training we've just had today, where we've learned about monitoring, reporting and documentation and reporting on human rights violations. I think this is the best platform for me, because I'll go back home and tell my team so that we can be able to monitor this and also be able to report them accordingly, and even advise our community to report them, because when you found the data at the police or even the hospital, the data is very low, but these incidences reach to us directly as human rights defenders are many, but they are not be able to be reported.
Well, greetings. My name is Judy Kipkenda. I come from the Ogiek community of Kenya, from Baringo County. I'm the executive director for Koibatek Ogiek Women and Youth Network, women and youth-led organization that champions for so many aspects for the community, including gender-based violence. We are fighting against gender-based violence. We are advocating for sexual and reproductive health, among many other things. We are also grantees of NAAPU, and what I want to report, since the last baseline survey that we did, we've seen, we were expecting after COVID that there will be a decrease in GBV, because COVID really and actually increased the GBV situations in our communities within Baringo County, not only in my community, but within other communities in Baringo County. But when COVID subsided, unfortunately, the GBV situation continued. It continued going up, and there was so much school dropouts. There was so much increase in female genital mutilation. There was also so much increase in early child marriages. But I have in Baringo County, the county government of Baringo County are currently coming up with they passed a bill which wants to support setting up of rescue centers for the victims and survivors of GBV, which we think it's a good thing. Although one thing that we want to continue doing is to continue advocating against GBV as a vice. And I'm very grateful for the training that we received today on monitoring documentation, because we were able to share so much with the other participants. We were able to share on ways and steps to follow, because during the baseline that we did, we found out there were issues with the community members. They reported to us that they could not access the duty bearers, and because there was lack of gender desks in the region, and if they did, they were at risk, because you could find the duty bearers responsible for making sure they're safe and tackling their issue would then go back to the perpetrators. So the learnings that I've taken today from this meeting is going to be very helpful, because now I've learned the correct steps to follow when tackling such kind of issues. And well, this one I'll go back to the community, train the other community leaders, the Nyumba Kumi leaders, the elders, then they will know how well, and other women who are champions for anti-GBV, I'm going to teach them what I have learned from today on the best ways to follow in addressing GBV issues.